You did everything right. You followed the science on COVID. You got the shot, and you're being put back into masks to protect the people who couldn't be bothered to protect themselves through vaccination. Yes, so doctors also say this is about protecting vulnerable people who want to get the shot and can't get it, or people who got the shot and are still at elevated risk. Here's Anusha Roy.
Once you get cancer, your perspective on life changes.
Sandy Boyer has lived in lockdown since the pandemic started. After getting her vaccine, she enrolled in a study for the immunocompromised. And that's when she realized the protection she thought she had.
That wasn't necessarily the case.
Then she hoped if more people got their shots, her life would have a chance to open up.
I certainly would have played it safe for the foreseeable future, but I also expected to be able to go out shopping, by myself.
She's a part of a group of patients with cancer, lupus, transplants who don't always have as much of a robust reaction to the vaccine and are closely watching the Delta variant and new mask guidance. This isn't the only group doctors are now suggesting should either continue or revisit their COVID precautions.
The CDC's guidance was really confusing for a lot of folks.
There are kids who are not eligible for their shots, and doctors say the science behind understanding the small percentage of breakthrough cases is changing.
That's why they're starting now to change the guidance that says, look, even if you're vaccinated, you should get tested if you're symptomatic. You should also get tested if you've been exposed. And that's really different for a lot of people. I know a lot of folks were kind of like, wait, that doesn't make any sense to me. I don't understand that. And the reason is that now we're starting to see more data to say, look, that virus can live in people's noses. They actually can be potentially contagious as well.
Does it vary for someone who's asymptomatic versus symptomatic for a breakthrough case?
We don't know yet. I think this is where it's really hard.
Intuitively more likely that if you have symptoms, you're more likely to spread it to others.
It's wearing a mask. It's still, you still get to do all the things you want to do. You still get to see the people that you want to see. We just have to be careful again.
For Next at Night, I'm Anusha Roy.
Public health experts say the fundamentals of fighting COVID remain the same. The masks have some value. Vaccines have far more value. So they say continuing to try and convince people to get vaccinated is the path away from masks.